Hi, everyone. For who's just now joining us, if you could please drop your name, your pronouns, where you're calling from, and if you have a favorite superhero, drop that as well. I see someone has asked me which Spider-Man is my favorite in the chat. I appreciate the question. My favorite Spider-Man is definitely Tom Holland's Spider-Man. I think he's the best in terms of he actually looks like he's in high school. So that relatability factor, I think works well for him. Someone said their mom. That's great. My mom is also my superhero, for sure. All right, folks, we're going to give it another minute and then we're going to go ahead and get started. If you're just now joining us, if you could drop your name, your pronouns, where you're calling in from, and if you have a favorite superhero, please drop that as well. Wow, someone said that they're a villain person. Okay, that's great. All right, folks. Well, it's 5:05 here in my time zone, at least. So we're going to go ahead and get started. Thanks, everyone, so much for joining us for today's webinar, Tennessee Blues, Exploring HIV Criminalization in Tennessee. I'm your moderator, your host for this evening's festivities. My name is Elena Ferguson. I use she, her, hers pronouns. I'm a policy specialist at Positive Women's Network USA, as well as the coordinator for the Health Not Prisons Collective, one of your co-sponsors of tonight's event. You can go to the next slide, Barb. Next one, too. Thanks. So just a little bit of logistics before we really get going on the content of today's presentation. This meeting is being recorded, so just be aware of that. If you are using your phone, to come off mute is *6. If you have any questions, please direct them to the Q&A function that should be on the left side of your screen. We will be addressing all questions at the end, so don't worry. We may address a few here and there throughout the presentation, but we'll be saving most of them for the end. Next slide, Barb. We've already done this. Thanks everyone who introduced yourself in the chat. We really appreciate it. We got a lot of varieties of superheroes, so that's good to see some diversity in that. Next slide, Barb. So just a little bit of an agenda for today's webinar. First, we're going to talk a little bit about the Health Not Prisons Collective and what we do there. Then we're going to turn it over to Nathan Cisneros from the Williams Institute, who's going to present a little bit about this groundbreaking report that they just released on the impact of HIV criminalization in Tennessee. Then we're going to hear from the Tennessee HIV Modernization Coalition co-chairs, and then our big kind of piece, my favorite personal piece of today's presentation will be speaking with two local Tennessee advocates who will be sharing their perspectives and stories around HIV criminalization. And then to end this out, we're going to be talking a little bit more about how you can get involved with Health Not Prisons Collective, as well as the coalition as well. So just a little fun interaction, just a little poll for folks, if you could drop it in the chat. Where do you think most people living with HIV who are criminalized based on their HIV positive status live in Tennessee? And that can be city or county or both. All right, we're seeing some Shelby counties, some Memphis, a lot of Shelby counties so far, both Knoxville. Okay, yeah, a lot of Shelby counties. Your instincts are correct. We will get to that later in the presentation. Yeah, but your instincts are definitely on the money. Shelby County is the highest, and we'll be talking more about that later in our presentation. So thanks everyone who wrote in posts. Next slide, Barb. So just a little bit about the Health Not Prisons Collective, H&P for short. We are a collective composed of 5 partner organizations. So included our Positive Women's Network, where I work, the Counter Narrative Project, the Zero Project, the U.S. People Living with HIV Caucus, and the Transgender Law Center. And so together, we've kind of come together to work around decarcerating public health. And we primarily do that through the process of trying to end HIV criminalization and taking a grassroots intersectional approach to doing so. Next slide, Barb. So I guess the unique thing about all of the organizations within H&P is that we are led by and accountable to people living with HIV. And we kind of work around this issue using a variety of different tactics and strategies, ranging from education and training to policy analysis to narrative change. So we use a variety of different things to kind of discuss and engage around HIV decriminalization. And, there are several, we have 8 principles that we kind of are grounded in at H&P, but I think the primary ones that are most relevant to today's conversation will be our first one here, community power and meaningful involvement of people living with HIV. As I said, all the partner organizations in H&P are accountable to and oftentimes led by as well people living with HIV. And we also recognize that, in any discussions or any kind of narratives around ending HIV criminalization, it has to start with input from people living with HIV, and they have to be meaningfully involved in trying to end these laws across the state. And then another big principle that I think really is really relevant to today's conversation is the racial justice principle. So we know that, Black and brown Tennesseans are being over-policed or being over-surveilled, are more likely to find themselves caught in the web of the criminal legal system. And that is no different if you're a person living with HIV and you are being prosecuted under Tennessee's HIV criminalization statute. So definitely those 2 principles are kind of the core of what we're going to be discussing today. So just a little bit of an objective for today's presentation. I hope that all of you will have by the end of this presentation, I hope all of you will have a better understanding of the state of HIV criminalization in Tennessee. I hope that everyone will have a deeper understanding of the link between HIV decriminalization and sex work decriminalization, as well as everyone will kind of have a better idea of how to work around ending HIV criminalization in Tennessee, including by joining the Tennessee HIV Modernization Coalition. So I guess when, my partners and I in this presentation were coming together and discussing why we wanted to do this presentation at the time that we're doing it, we really wanted to tie it into Southern HIV/AIDS Awareness Day, which is August 20th. So it's in a couple of days. Because, Tennessee is in the South, and the South has a greater burden in terms of HIV infections, diagnoses, and deaths compared to any other US region. So people living with HIV and who live in the South, that's just a completely different experience than, I guess, other regions. And so we really wanted to draw attention to that fact with our presentation today. So I guess like these next few slides are just going to discuss like some of the ways that the South is particularly burdened when it comes to people living with HIV in terms of like new diagnoses and just treatment and stuff like that. So for example, the South accounted for only 31% of the nation's PrEP users. So PrEP as in the drug that folks can take if they want to prevent themselves from getting HIV if they are having sex with someone who is HIV positive. So the South accounted for only 31% of the nation's PrEP users, despite accounting for more than half of all new HIV diagnoses. So there really isn't as much PrEP being taken and used in the South as other regions. And I think another kind of interesting statistic that I think will be really relevant to today's presentation is that in the South, HIV prevalence was nearly 15 times higher among Black women in the South than among white women in the South. So we know that HIV is affecting Black women in a more disproportionate rate in the South. And I think we're going to learn a little bit more about that, about why later in today's presentation. Yes, and so a lot of, I guess a few reasons why the South is really struggling in its HIV response, but a lot of that stems from poverty and just lack of health insurance coverage. A lot of states in the South haven't expanded Medicaid, which kind of contribute to make this horrible cocktail of not being able to access treatment and services, healthcare services you may need. Yeah. Next slide. Yeah, so we have some really amazing panelists for you all today, and I'll just kind of introduce them one by one. So first we have Nathan Cisneros. He is a HIV criminalization analyst at the Williams Institute. He was previously in the political science department at UC Irvine, and before that worked as a case writer at Harvard Law School studying the legal profession. At the Williams Institute, Cisneros is applying his training in quantitative social science to the impact of HIV criminalization laws on people living with HIV. His other research interests include comparative public policy and the regulation of labor and employment. He is an alumnus of the IIE Fulbright program in Japan. Cisneros received an MS in political science from the Massachusetts Institute of Technology and a BA in Japanese economics and political science from UC Berkeley. Welcome, Nathan. Our next panelist that we have for you today is Robin Lennon Deering. She is an associate professor, or Dr. Robin Lennon Deering, excuse me, is an associate professor at the University of Memphis School of Social Work. Her direct experience is in healthcare and medical social work, and her research agenda is focused on HIV disparities and social justice issues. She is a member and co-chair of the Tennessee HIV Modernization Coalition. Next slide, thanks. So our next panelist is LaShonda Salinas. She is a native of Hartsville, Tennessee. She is a member of the Tennessee HIV Modernization Coalition and currently serves as a Health Not Prisons Collective advocate and is also a member of the Elizabeth Taylor AIDS Foundation Council of Justice Leaders. She has been living with HIV for more than 20 years. Her advocacy started after facing an unjust HIV prosecution under Tennessee's criminal exposure statute, placing her on the sex offender registry. And our final panelist, certainly last but certainly not least, is Michelle Anderson. She is a Mississippi native currently living in Memphis, Tennessee, and she has been an advocate for HIV/AIDS, LGBTQ+, trans equality, and decriminalization of HIV since 2014. As an early intervention specialist for a local nonprofit in Memphis, Michelle provides assistance to newly diagnosed or lost to care clients who want to be linked or relinked to care. Michelle provides a support system and encouragement for clients to help the clients become retained in care and reach viral suppression. Michelle herself has been living positively since 2007 and feels that helping people who are experiencing living with HIV and AIDS has become her calling. She says, "I feel that sharing some of my experiences with battling homelessness, discrimination, stigma, etc., may help someone in similar situations feel that they are able to accomplish anything they set their minds and hearts to, just like me." Michelle is currently working with the Tennessee HIV Modernization Coalition to decriminalize HIV in the state of Tennessee. She says, "As a person being affected by these laws myself, I want to see change and be a part of the change as well." Michelle states that she is interested in starting her own nonprofit in rural Mississippi to assist individuals living with HIV, LGBTQ+ folks, and all individuals to have a safe space to learn more about thriving with HIV, advocacy, and community connections. As a Barbie collector, Michelle's biggest dream would like to be to become her own Barbie, representing for the HIV community and trans community. Welcome to our panelists. So happy to have you all here. So now I'm going to turn it over to Nathan Cisneros. He's going to talk a little bit about the Williams Institute and this amazing report that they just released on the impact of HIV criminalization.
Thank you for the introduction. If we can stop sharing that screen, then I'll share my screen and we can begin. I'm looking forward to that Barbie doll. I'm gonna buy that Barbie doll for everyone I know. That's gonna be everybody's Christmas birthday present. So why don't I get right into it. So my name is Nathan Cisneros. I'm the HIV criminalization analyst at the Williams Institute. The Williams Institute has been studying the enforcement of HIV criminal laws since 2015. What I'd like to do today is give us a very brief introduction to what we mean by HIV criminalization, share with you some findings, some patterns that we've seen over and over in our analyses of HIV criminalization across the United States, and then look at some findings from a recent report that we did on HIV criminalization in Tennessee. Before I begin, I want to note that I'll be presenting a lot of numbers, a lot of figures, charts. There are real people behind each and every one of the numbers. I want to acknowledge that at the very beginning. And it's unfortunate. Yeah?
You're in presenter mode. I just wanted to let you know.
Oh, okay. Let me see how I can do that. Let's see if we can do, there we go. How about that one?
That's perfect. Thank you.
All right. Thank you for telling me. I wish that we had the individual names of people to memorialize here instead of numbers. So what do we mean by HIV criminalization? I think at the very beginning, I always like to point out that we all, each and every one of us, have an HIV status. That status might be positive or negative, and we might know our status or we might not know our status. So HIV criminal laws, HIV criminalization is criminal laws that make conduct illegal based on somebody's HIV status or that create penalty enhancements, again, because of somebody's HIV status. You can see in this map, there are 30 states as of 2022 that have HIV-specific criminal laws. HIV criminalization is not a red state or a blue state issue. It's not a big state or a small state issue. Moreover, even in those states that aren't colored in on this map, people are still vulnerable to prosecution under general criminal laws. And in fact, there's a citation at the bottom, Center for HIV Law and Policy. You can go state by state and look at examples of prosecutions under both HIV-specific criminal laws and general criminal laws. So now I'll go through these four, I call them big takeaways from Williams Institute reports looking at HIV criminalization across the United States. I'll walk through them each in turn. And the first one is that HIV criminalization is not going away over time. We sometimes hear from policymakers that are surprised to learn that these laws exist or that they're still on the books. And secondly, they're surprised that enforcement is still happening. And I have two examples here. On the left-hand side, we have, over the last 2 decades, the number of people who have entered prisons, state prisons in Georgia because of HIV-related convictions. On the right-hand side, we see interactions with law enforcement, arrests essentially in Missouri over the same time period. And what you can see is that whether it's incarcerations or arrests over time, this is not a problem that's going away. And in fact, in Missouri, for example, things seem to be getting worse over time. And these are not cherry-picked examples. We just received some data from Louisiana, and we saw arrests happening in the last 2 months because of that state's HIV criminal law. Within each state, and this is the second big takeaway, we see real geographic differences. And here's an example from Missouri. So on the right-hand side, the purple shaded map, that shows the people living with HIV by county in Missouri. People living with HIV live in every county in the state of Missouri. There's a little bit of concentration, but people living with HIV live everywhere in the United States. On the left-hand side, we see arrests, essentially incidents with law enforcement because of an HIV criminal law. And what we see is really strong geographic concentration, especially in St. Louis. That's the dark blue on the right-hand side of that map on the east side, and in Kansas City on the left-hand side. And these geographic differences are driven by policing, practice, and policy. And in fact, we'll see a little bit of this difference later on in the presentation. What is St. Louis doing with sex work versus Kansas City? I'll come on to the third big takeaway, and this is unfortunately a pattern that we see every single place we look. Black Americans are overrepresented in the HIV epidemic, overrepresented in the epidemic of mass incarceration and over-policing, and especially overrepresented at the intersection of those two, that is HIV criminalization. So we have arranged on the horizontal axis here a number of states for which we have comparable data, and I want to draw your attention to those orange bars on the right-hand side. That's the share of HIV-related convictions in each state that went to Black people in the state. And what you see is, whether we're comparing that to the share of Black or African-American people in the state's population or people living with HIV in the state, that orange bar is bigger, meaning that Black people are a bigger share of people getting sent to prisons and jails because of an HIV-related conviction than their share of people living with HIV or the state population overall. Several states have criminal laws that target specifically sex work while positive. And we see where sex workers are singled out for particular scrutiny under a state's HIV criminal laws, that Black women especially are vulnerable to police and system involvement. So we have a similar figure here. Now we're looking at HIV-related sex work arrests and just looking at Black women. And what you see is, for example, in Georgia, Black women are only 17 or 18% of the state's population, however you slice it. But Black women were about half of all sex work-related HIV arrests. I'll come on to the fourth big takeaway from our look at national trends, and that is that these HIV criminal laws are not related to what a public health official or an epidemiologist might think of as risk. I wouldn't use that term, but I think even if you take that position, people are being arrested, convicted and incarcerated for behaviors that could never be a transmission risk. And I want to look specifically at Tennessee's two HIV criminal laws, and then we'll turn to Tennessee in more detail next. So we'll start with aggravated prostitution. This is essentially sex work while positive. What does that mean in Tennessee? So if a person is positive and they know that they're positive and they engage in sexual activity as a business, they're liable for a felony conviction, 10 years in prison, and mandatory lifetime sex offender registration. Moreover, sexual activity includes behaviors that don't involve physical contact. For example, a peep show is enough to sustain a felony conviction. It also includes activities that are not a transmission route, for example, a hand job or oral sex. Moreover, you'll see in that third bullet point, loiters in a public place. That means standing on a street corner, essentially, for the purpose of being hired to engage. That essentially means a conversation. So a conversation about sex work is enough to sustain a felony conviction, 10 years, up to 10 years in prison, and lifetime sex offender registration in Tennessee. I'll go over to criminal exposure quickly. Criminal exposure is a non-disclosure law. So if a person is positive and they know their positive status, they have an obligation to first disclose their status before intimate contact with another. What does intimate contact mean? It means exposing another person to bodily fluids. And the statute says in a manner that presents a significant risk of transmission. Well, the courts have defined significant risk to mean basically there is a chance. It's a non-zero probability. So even if it's a slight probability, I would not interpret that as significant risk, but courts in Tennessee have interpreted that as significant risk. I'll point out that neither of these laws take into consideration mitigation strategies, for example, condom use. I'll mention here as well that if a person who's positive is in effective medication treatment and their viral load is undetectable, that means you can't detect HIV in their blood, they cannot pass on HIV to another person through sexual contact. Moreover, as Elena mentioned, if the negative person is in effective medication treatment, is taking, for example, PrEP, then they cannot get HIV from sexual contact. Most of the laws that we've looked at across the United States don't require actual transmission, intent to transmit, or as we see with aggravated prostitution, even the possibility of transmission. So let's turn now to Tennessee. Here's our Tennessee report. This is the landing page. The URL is at the bottom, but if you just Google Williams Institute Tennessee, it should be the first report. The first search result that you see. So now I want to walk through, as I did with the national data, some key takeaways from that Tennessee report, and all of the details are in that report, and I'd be happy to answer questions later on. And you'll see that these look very similar to the national trends. Tennessee, unfortunately, echoes some of those difficult patterns that we've seen elsewhere. And I'll start with sex workers. So unfortunately, we were not able to get from the state of Tennessee. We tried very hard to receive comprehensive law enforcement data about contacts with police officers, essentially, because of an HIV crime. We also tried to get prosecutions. We couldn't get that. But what we could get was the sex offender registry data. So again, Tennessee has mandatory lifetime sex offender registration for everybody convicted of an HIV-related offense. And what we saw when we analyzed the sex offender registry was that the majority of people on the sex offender registry for an HIV-related crime were there for sex work, aggravated prostitution. Moreover, in the sex offender registry, they have a partial, what they call criminal history. This is contacts with law enforcement. We can use that to get a sense of contacts with law enforcement that maybe didn't result in a final conviction. And what we see is people are still being caught up in the criminal system, still getting caught up with law enforcement, even today. Maybe not today exactly, but we saw when we collected the data in early 2022, already at least one person who had contact with police because of an aggravated prostitution allegation. Criminal exposure is that orange bar. You can see it's more or less steady. It bounces around a little bit over time, but from the late 90s to 2022, both aggravated prostitution and criminal exposure contacts with law enforcement continue. So this is not a problem that has gone away in Tennessee. we see, and it's actually quite stark in Tennessee, that Black Tennesseans and women are particularly vulnerable to HIV criminalization. And I'll show you some figures to drive home that point. First, I'll look just at Black women, just at Black people and just at women. And what you see is, I want to draw your attention to that yellow bar. That yellow bar is the share of people on the sex offender registry for an HIV-related conviction. And what you see is that women are about half of people on the sex offender registry for an HIV-related conviction. Women are about 4% of the overall sex offender registry. Women are about a quarter of all people living with HIV. So women are disproportionately affected. If we go over to Black people on the right-hand side, Black people were 75%, 3/4 of people on the Tennessee sex offender registry because of an HIV-related conviction. Black people are not 75% of Tennessee's population, at least not right now. We'll see. Likewise, if we break it into smaller demographic groups, and again, I want to draw your attention to Black women. So Black women were 1 in 3 people on the sex offender registry for an HIV-related conviction. If you round up, Black women are 1% of the overall sex offender registry. And I'll draw your attention as well to white women. You also see this disproportionality with white women, but again, this intersection of Black identity and woman identity makes you even more at risk. So for white women were 14% of people on the sex offender registry for an HIV-related conviction, but only 3% of the overall sex offender registry, only 6% of people living with HIV in Tennessee. The only major demographic group where we didn't see this disproportionality in the same direction is with white men. So white men were only 12% of people on the sex offender registry for an HIV-related conviction. White men were over 2/3 of people in the sex offender registry overall. White men are a little under 1/3 of people living with HIV in Tennessee. And I'll finally come to the big takeaway, and we'll dig in some more on Shelby County. So what when we tried to figure out where people were being convicted, what we found was that not just the plurality, not just the majority, but the overwhelming majority of people being put on the sex offender registry for an HIV-related conviction seemed to be coming from Shelby County. And I'll give you some maps and figures to look at. You have 2 maps of Tennessee. The map on the top shows people living with HIV in Tennessee by county. And you see, just like in Missouri, people living with HIV live in every county in Tennessee. You see there's a little bit darker shading in the middle. That's Davidson County. That's where Nashville is. And you see a little bit darker shading in the lower right-hand corner, or left-hand corner, far west of the state. That's Shelby County. That's where Memphis is. If you look at the bottom map, that's where people live in Tennessee who have an HIV-related conviction in the sex offender registry. And what you see is, Davidson County is a little bit shaded in. Shelby County is really, really shaded in. And I've drawn arrows to show you what that looks like. Shelby County had about 2/3 of people on the sex offender registry for an HIV-related conviction. Davidson County had 9%. Davidson County and Shelby County, Nashville and Memphis and the surrounding areas are about the same population. And I'll say it again, Davidson County less than 10%, Shelby County about 2/3. And we can look at Shelby County a little bit more. Shelby County, about 13% of the state's population, about 17% of people on the sex offender registry, a little over 1/3 of people living with HIV. But if you go to aggravated prostitution, for example, Shelby County is 3/4 of aggravated prostitution convictions in the state, and just about half of criminal exposure convictions on the sex offender registry. So something is going on in Shelby County. Our co-author, Robin, who you'll hear from next, was able to, in Shelby County, get, I'll wait 1 second, get about just under 80 case files of individuals in Shelby County who were arrested and convicted of an HIV-related offense, either aggravated prostitution or criminal exposure. So we were able to dig into the details a little bit. And what we see is that Shelby County is criminalizing people living with HIV at rates that we weren't able to observe in comparable jurisdictions either inside Tennessee or outside Tennessee. So you see here, Missouri also has a sex worker specific law, but I want to draw your attention to this bottom row. What it's saying is that there is one aggravated prostitution conviction in Shelby County for every 115 people living with HIV in the county. It's 20 times higher, at least, than what we saw in St. Louis. In Jackson County, the sheriff, it's either the sheriff or the DA, there decided that they wouldn't enforce their sex worker statute. So there were no people convicted in Kansas City under that state statute. So we think this is a policing policy or practice issue. So diving into those case files, what we saw is that over 90% of people who were arrested, again, arrested, convicted, and put on the sex offender registry for aggravated prostitution were Black. You see 75% of the people were identified in the police records as Black women. We suspect that given the choice, a number of people who weren't able to identify as Black women would also identify as Black women. Regardless, though, looking just at race ethnicity, Black people were the overwhelming majority of people subject to enforcement. We were able to dig in a little bit deeper, figure out what are the circumstances under which somebody was arrested for aggravated prostitution. What we discovered was over 90% of the arrests and convictions followed the same pattern. Memphis Vice Squad sent an undercover police officer, plainclothes police officer, to solicit someone on the street who they think is engaged in sex work. The allegation is that there was an arrangement for a sex act in exchange for something, and I say something because in one case, the exchange was for a place to sleep for the night. So once the alleged agreement is reached, a takedown notice is given, the person is arrested, taken to the jail, they find out their status, and now they're liable for a felony conviction. If the person's status was negative, they would be liable for a misdemeanor citation, but because they're positive, and there's a record of that, now they will face years in prison and sex offender registration. So in 100%, and I'm looking at the right pie chart now, 100% of those cases that involve the Vice Squad or plainclothes police, there was no allegation of any sex act. The allegation was a conversation about a sex act in exchange for something. And if you look at what the alleged sex acts were, about half of them, the riskiest act proposed was oral sex. Oral sex is effectively not a transmission route. The dollar amount was on average about $16. Even for vaginal sex, the price range was between $20 and $30. The riskiest behavior we could identify, which would have been receptive anal sex, we think was proposed in 0 to 4% of arrests. The latest medicine says that the per act risk of transmission, if no mitigation strategies are attempted, is still, close to 1%, right? So well, I'll leave it to you to interpret whether this is substantial risk or not. I'll also note that if mitigation strategies are taken, or if, for example, the person living with HIV is in effective medication treatment, for all of these behaviors, the risk drops to 0. I want to underline, though, in none of these 95% of files that we looked at was there any allegation of any actual sex act going on. And I'll close out here on criminal exposure, and really just to emphasize on the left-hand side, 100% of the case files that we analyzed involved a Black person, and only one of them didn't involve a Black man. And the one, this is a single person here, that was the one non-sexual exposure allegation. And in that case, the allegation was the person spit on somebody in, I think it was a hospital. That spitting is not a transmission route. That person received 8 years in prison. So I'll close here. Here are other states. I'd be happy to talk about them, but even happier to talk about Tennessee. And I'll turn it over to Robin now.
Thank you, Nathan.
Actually, before we get to Robin, can I just address one question in the chat just live while we have it, that I think is relevant to your presentation, Nathan? And thank you so much for presenting all of that data. We're really going to need it in our kind of quest to end HIV criminalization. So thank you so much. But this is a question from Connie Garrett, which is, why are Blacks and people of color always the highest, I guess, in the conviction rates is what she's referring to. And I'll kind of put it, we could probably talk all day about this, but I would definitely kind of, to boil it down to just kind of anti-Black racism, state-sanctioned violence, white supremacy, over-policing, surveillance, vulnerability, poverty. That's kind of the short stick of it, but anything else you'd like to add, Nathan?
No, I think you probably covered it all. I would also love to hear from our co-panelists later on about their lived experience with police interactions. I think there's a lot that can be said from individual stories.
Yeah, thanks so much, Nathan. And now I'm going to turn it over to Robin.
Well, good afternoon or good evening, everybody. Be able to get to my slides. So I am a professor of social work, and I study the impact of HIV criminal laws from the perspective of people who have been arrested. And I want to tell you 3 reasons that these laws are absolutely horrendous. First, there's no reason or federal legal requirement for a consenting adult to be put on the sex offender registry if their crime did not involve children, violence, or coercion. There's no research or evidence to suggest that putting consenting adults with HIV on the sex offender registry would protect the safety of children or the public. None. Being on the sex offender registry keeps people that are convicted of an HIV crime away from children, even though their crime did not involve children. Secondly, Tennessee's HIV laws do not require that someone intend to transmit HIV or actually transmit HIV. In fact, arrest does not require any physical contact. For example, to be charged with aggravated prostitution, as we just heard, if a defendant simply gets into a vehicle with an undercover officer, they're guilty. So police officers are targeting people on the street who they assume are sex workers. They may be homeless, dealing with an addiction, living with mental illness, or any number of causes that would result for them being on the street. Thirdly, individuals who are arrested and convicted of an HIV crime have no means to fight the charge. They have no means to say, hey, I'm not guilty, I have not done this. Without the financial resources to afford bail, much less legal representation, they are given a public defender who typically advises them to plead guilty without telling them about the invisible consequences that will follow them for the rest of their lives. HIV criminalization exists in the context of many other forms of structural inequalities that privilege some members of society at the expense of others. Next slide. HIV criminal laws, including aggravated prostitution, target the most vulnerable, marginalized communities, reinforcing and perpetuating stigma, racism, sexism, transphobia, and classism. HIV convictions primarily happen to people who are least able to fight the charges because of their place in the social hierarchy. Members of multiple minority communities, members of highly surveilled communities are all vulnerable to policing practices such as profiling, entrapment, harassment, and violence. And knowing their HIV status increases their vulnerability. And these negative interactions with police, they continue during the arrest and the booking process. They can be humiliating, traumatizing for individuals from marginalized communities who lack power and resources. The Williams Institute report, we were not able to count the number of people who may have been misgendered and identify as a transgender experience. My research has found that transgender communities have been highly impacted by the HIV laws. Next slide. Many women who do street sex work do it for economic survival. For transgender women, the reality of transgender discrimination frequently prevents them from obtaining housing and jobs. Homelessness is a critical issue for transgender people, and sex work is often an economic necessity due to discrimination and stigma. And in speaking with trans women about their experiences, they say that all people, including law enforcement personnel, assume that all transgender women are prostitutes. Yes, if they see you walking in Midtown and you're trans, you're a prostitute. That's the assumption. And I've been told that this is an unwritten law, walking while trans, which is when a police officer sees a person, a transgender person of color, they stop them. And this is not just in Memphis, this happens all over. Next slide. Women, particularly women of color and women of trans experience, may face violence if they disclose their HIV status, and they risk prosecution and arrest if they do not disclose. So disclosure might increase the potential for their victimization and abuse because it creates power differentials in a relationship where a person's HIV status can be used to threaten and control them and make it harder for them to leave violent, abusive relationships. Next slide, please. Once in the criminal justice system, a person's private medical information becomes public, and then the character assassination begins. Individuals who have not transmitted HIV nor caused any harm are in a position where they constantly have to defend themselves. One person said, I think a lot of people go through the criminal justice system, but they don't receive the justice that they need, especially being that you're HIV positive and going through there. We all deserve justice, regardless of who we are or what we are going through. And having HIV, you get labeled as being a sex offender, which is crazy. You want to further drag me through the mud. And not just that, you want to put my HIV status out there for everyone to know. Having HIV does not mean that we are criminals. Next slide. Permanent damage results from an arrest and conviction for an HIV crime. Individuals lose the ability to become self-supporting and self-sufficient. One person who has been criminalized said, I've had jobs that tell me because I was a registered sex offender that I could not work there. It has been messed up my life completely. Those two things, a job and somewhere to stay, it's what you need, you know what I'm saying? And I've been denied both numerous times. In addition to preventing people from obtaining a job and a place to live, being labeled as a violent sex offender is especially painful to women with children and grandchildren. One woman who had been criminalized said, when I got charged with aggravated prostitution, like I said, I was addicted to drugs, but I've been clean for 15 years now, and being on the sex offender registry affects me tremendously. I have grandkids that graduate kindergarten, and I can't come. Why? Because they're putting my HIV status into the same category with a person that sexually molested or raped a child. I've never, ever been convicted of passing HIV to anyone, let alone doing something to a child. How can I explain this to my grandchildren? Next slide. These are just a couple of the harsh realities that people who have been convicted of an HIV crime in Tennessee have to deal with every day. Hearing people in these types of circumstances over and over were noteworthy as to why the Tennessee HIV Modernization Coalition began. These laws are outdated and unfair, and they are largely ignored because of the people who they affect. People from minority or marginalized communities who are not connected to political power. A critical component to making changes to the HIV laws is for the community, people who are living with HIV and communities that are heavily impacted by HIV, particularly communities of color and the LGBT plus community, should be engaged in modernizing the HIV laws. The Tennessee HIV Modernization Coalition has worked with assistance from the Center for HIV Law and Policy and Zero Project. And our goal is to revise the Tennessee statutes and to repeal the aggravated prostitution statute. We're also asking for a new statute that will retroactively expunge sex offender status for all people arrested for criminal exposure to HIV and aggravated prostitution, unless their crime involved force, violence, or children. And I see that my colleague Dwayne is on the call, and I wanted to turn it over to him to see if he can add to what our mission and goal and accomplishments for the Tennessee HIV Modernization Coalition is. Thank you.
Thank you. I think that you've been doing it beautifully. I really am excited to just see that everyone is able to consume all of this information that yourself and Nathan both have been able to share. The coalition started back in 2014, or the work of it started in 2014, and the coalition itself started in 2018. But the reason why we started this is because of the mission goal and the accomplishments that you see here. Myself and Robin and so many others in Tennessee saw that this was an issue. There were groups that got together and wanted to work towards this, but I will say that the coalition has worked so hard on this and diligently, where we were able to actually introduce bill language to modernize the state statute. And I will say that we did that. I don't think the other groups have, but I, don't challenge that. I will also say that, what we want to do is center people who have the lived experience and a lot of the demographics that we named. Those people are the ones who's calling the shots and actually moving the needle forward to eradicate the criminalizing laws in the state of Tennessee. And even if that means to give of inspiration to other groups in other states, we want that to happen as well. So we're not, although we're worried about Tennessee statute, we are very much so willing to work with other states and other coalitions and groups who are working on their state statute and trying to do the same thing. What we do understand is this is not about one of us, it's about all of us. I will say that I am a person that is HIV negative. However, I live every day as a Black gay man where, HIV is present every corner of my life. And, I want people who have to live through that experience and being HIV positive and having that state statute with them. I want them to have a better way of life, because I know me being a gay Black man in Tennessee is already hard enough. So when we start to add the state statute that would, eliminate resources for people with housing and also employment, even, talking about, trying to get higher education and get certifications to be able to have a better way of life and provide, people are missing out on those opportunities because this law is in place. And that those are the things that we're really focusing on and wanting to change. So Robin, thank you so much for giving me an opportunity to kind of like put my thoughts on what's going on here and what we are looking forward to doing in the upcoming year. And I would advise and employ anyone, if you are interested in the work that we're doing, please go to tnhivmc.org. Please go to our website, not only just to that website, but also go to AIDSview. That way you can get a lot more information. Even the Center of HIV Law Policy and Cyril Project, the Williams Institute, like Nathan was suggested earlier, and even the HIV Justice Network. These are all our colleagues, and we all work together in trying to change what the state statute currently is doing, where it's criminalizing and harming women of color in Tennessee, but not only women of color, but grossly women of color. And what we do understand, like, I mean, in society, the mothers are usually the first teacher. They're the ones that have the rest of the family unit with them. And this is impacting families, not just individuals. So once again, thank you so much for giving me an opportunity to speak on this. Nathan and Robin and Elena, thank you guys so much for having this platform. You guys have spoken beautifully about this.
Thank you so much, Dwayne and Robin, for sharing just a little bit about what the coalition is working on. And I think Kelly already dropped it in the chat. So if you are interested in joining the coalition, if you do want to learn more, please follow that link that she's dropped there. And now we're going to transition to our, I think our most important part of today's presentation, which is going to be hearing from our two panelists, LaShonda and Michelle. So we're just going to hop right in. So this is a question for both of you. How have these HIV criminalization laws affected you personally? Oh, I think you're on mute, LaShonda, if you're talking.
I am talking, I'm sorry. They affect me from getting a decent job, from going with my family on vacations. I can't do any of that. Anywhere a child could be present, I can't be there. And that goes for the grocery store as well. So if I have to go to the grocery store, I have to go very early in the morning when it first opened. And that's hard to do. And that's the way that it has affected me.
I would echo the same sentiments as LaShonda, but most people don't understand that it affects your whole life entirely. You have to really be able to have people who are in your corner who give you that support to keep going, because sometimes you, like LaShonda said, you can't get a job. That's very discouraging, and especially if you're trying to get a job to make ends meet. That's the hardest part. And also the living situations. They are really kind of, especially here in Shelby County, where there are schools and daycares and everything located almost in every corner. So you really just have to be able to have a good support system to be able to handle all that, because it's life-changing. I will say that, and it does affect all aspects of your life.
Yeah, thank you so much for those responses. Yeah, I think what people don't really realize is that, once you've been criminalized, like that has serious consequences that can last for a very long time. And I just don't think people really kind of put that together. LaShonda, this is a question for you. Can you talk a little bit about like the sex offender registry? I believe you have to like pay to be on it or keep being on it, correct?
Yes, you have to pay $150 every year. Not only that, you have to take sex offender classes that, real child molesters are in there, people that have harmed kids. And, it's hard to sit in one of those classes knowing that you're sitting next to somebody that's actually molested a child. That was the hardest for me in that group. And not only that, with some things, you want to see your cousins or your brother or your sister graduate. I can't do that. I can't go there. I'm getting married next year. I can't have a ring bearer, pallbearer. That's supposed to be my happiest day, but it's not going to be.
And I agree to echo that. It's actually $200 here in Shelby County that you have to pay every year. Because you paid the extra 50 goes to the police department for policing the individuals who are on the registry. So being on the registry, it kind of makes it really difficult when every 3 months, if you're on the because I am listed as a violent sex offender. I don't know how, but as a violent sex offender, there is no way to get off the registry. Even I was told that you have to be on the registry at least 25 years, and then you can petition to the state to remove you. But that's kind of just making you're not sure if they're going to agree to release you from the registry, or will you just have to continue to stay there? And to having to report, we have to go and report every 3 months with the registry to make sure no changes have occurred or anything like that. And if you miss those appointments that you have with the registry, they will issue a warrant out for your arrest. And that makes it a cycle, because some of the clients that I work with who are also on the registry, they're homeless, so they don't have any address for someone to come to, or they don't have any way to receive mail to remind you. So that leaves them out there in the whole loop of getting out of jail, getting rearrested, and the cycle just continues.
Mhm. I agree with you on that, Michelle, because, I seen a question in the chat box that I was just looking at, and it was talking about basically how long do you have before a warrant is issued? There's no certain time. They don't tell you when your warrant is issued. It could be right then. It could be 6 months from then. There's no telling when they're coming.
And then some people, in my case, I've witnessed this. Some people may have forgot the date that they were supposed to report, and they come in on good standing to try to report and maybe apologize to the officers or the system. At that moment, they are quickly to take you into custody. So maybe I have left my job a job that was hard to get at first. I left my job to come and report during the times that they have for you to report, and I may have missed it. So with me missing that can end up me being back in jail for just probably 30 minutes late, being up 30 minutes late to your appointment.
And with that, your first offense is automatically 90 days in jail.
Yeah, so I guess what I'm hearing is that you're both kind of speaking to this process of being constantly surveilled. Like once you're on the registry, and just really having to, the reporting and all of that, just kind of that constant, re-traumatization, surveillance constantly, and even like that and while also kind of having that lingering threat of being thrown back in jail, or just even, you know, let's say like you meet someone new and there's always that like possibility of, just as long as you're a person living with HIV, like they could turn you in to the police and say, oh, this person didn't tell me. Like, so you're constantly navigating those like kind of intersecting threats that are just kind of cycling around as well.
Elena, that's what I went through to get to where I am now. You know, back in 2006, 2007, I was with a gentleman. We called it quits after a year. I thought everything was going good until the police officer showed up at my job telling me that my ex-boyfriend has filed a report stating that I did not tell him that I was HIV positive. So that's how I end up in the situation I am in now, being convicted of this crime and on the sex offender registry.
Well, my case is opposite of LaShonda's. It was kind of what Robin Deering was talking about. I actually moved to Memphis to begin just a new life. At that time, there were no opportunities for trans women to advance in any kind of workplace. So I turned to sex work. And with turning to sex work, I did become infected by one of my partners that I was with, not doing sex work, but this was like a separate relationship. And with that, I ended up trying to get into the workforce, got into the workforce for a little while, ended up being released from that job and had to find a means to make rent, to buy food, to just get around town, like on the bus. So I had to start doing sex work again. In that moment, that's when I got solicited by a police officer, in which they did a prostitution sting, and I got caught up in that. So with being HIV positive, the charge was automatically aggravated prostitution. It wasn't could be considered as a misdemeanor or just prostitution. It automatically jumped to aggravated prostitution. And that ended up and after being convicted because I didn't have money to afford an attorney. So like Dr. Robin said, you don't have that option of fighting this. It's more so of, you did it, we say you did it, now you got to just admit that you're guilty, and we're going to throw you on the registry for lifetime.
And you know, with my public defender, I do have to say she did work for me. She was getting together, you know, specialists from infectious disease at Vanderbilt to anybody else she could find. But they gave me 3 pleas. Well, actually 2. The first one was 3 years in prison. I would have spent 18 months in prison and 1.5 years on probation. And the second one was 3 years on probation. You know, I took that plea because my father had passed away the day before. Now, when I went in front of the judge to take my plea, nobody in that courtroom said, well, when you leave here, you're going to be on the sex offender registry for the rest of your life. I didn't get told that until I had my probation transferred to Trousdale County. That's when the lady told me that I had 24 hours to go register as a sex offender. So they don't tell you these things in court.
Mine was opposite of yours, LaShonda. My public defender He did not want me to get probation. He wanted me to just plead guilty and do the time. Unfortunately, I started advocating for myself, and I asked about probation, which I was granted. But it was, like LaShonda said, a 3-year probation. And then after that, same as LaShonda, when they put you on the probation, that's when they want to tell you that, oh, you have to go and register as a sex offender. So me being a person who goes to the place to get probation, and then I have to turn around and leave there and then go register as a sex offender, I wasn't comprehending all of that, in which I got in trouble for, because the directions weren't right. They weren't correct to how you have to go about the process of applying to be. Then it's not even applying, how you have to go through the process of going to be on the sex offender registry. It's a process. A lot of questions, a lot of intrusion. It feels very invasive when they're asking you questions about your status and that does not even relate to sex offense. So it's a very, I'm sorry. It's a very,
It was something to me that broke me down.
yes, it's so very unfair, especially to the people who aren't even sex offenders, just someone who's just living their life and they just happen to acquire a virus. So, yeah. Sorry, LaShonda, I didn't mean to cut you off.
Hey, girl, we got carried away.
But can I add to what Michelle and LaShonda are saying? I know a lot of people are like kind of like stunned and like, how can this even be legal? And how can they even be able to, to have this reality? Well, the thing is, the state statute was formed in 1989, and I think it was actually passed in between there and 92. But that state statute at that time, you have to consider what was the snapshot in what's in society and their opinion about HIV at the time, which was lack of knowledge, lack of sensitivity, really, very conservative position about commercial sex workers and a lot of, other people who would be other. So even people of color back then, women back then, did not have the agency to be able to actually be considered in a law like this. So that's how we end up here. The problem is a lot of people back then were like, oh, this is actually to protect, or the law was placed there to be like a way to have a buffer for public health and keep public health intact. However, what it did was immediately criminalize people with the HIV diagnosis in the state of Tennessee. And on top of that, gave a lot of leeway to law enforcement, even going back to it, like the aggravated prostitution thing was added later. It's going back to it and saying that, okay, now you police officer, sting person, you can go and do a lot more, with the prosecutor and have a lot more longer sentences and making stuff stick. So that's pretty much the idea around that. So that's why I know a lot of people were someone even asked about the DA's race that just happened in Shelby County. That race will hopefully, the result of that race will show us some favor in doing this work specifically in Shelby County. I did want to address those things, but I want to give the floor back to LaShonda and Michelle, because you guys are even educating me on some of the new stuff that I didn't know that you're having to live past.
Yeah, thanks so much for sharing that, Dwayne. And thank you so much, LaShonda and Michelle. I know this is very, traumatizing to go through this again and again. And we're just so grateful to have you both here and to be willing to share your stories with us today. Just another question I have for you both. So as we've kind of learned today, you've both been criminalized based on your HIV status within Tennessee. And you might think, or most people might just kind of stick to themselves after that type of experience and just kind of try to just not really engage a lot. I could definitely see how someone could choose that path, but both of you have decided to choose a different path, which is the path of advocacy around HIV criminalization, around other issues related to HIV positive people or people living with HIV. Can you talk a little bit more about like how like this kind of horrific experience has kind of propelled you into this advocacy that you both do now?
Well, for me, sorry, trying not to get stirred up, but this has made me want to fight a little more because, there's people out there that don't know this information, never heard of it. Some people that are living with HIV, they don't want to speak up because they're too scared. So I want to be that voice for them. If it's not for me, for them.
Well, for me, I want to say, I don't want to say accidentally rolled into advocacy, but it was something that I felt that some stuff needed to be changed. And when I started going to like advocacy meetings and things like that, to really learn about the virus, because I didn't have any knowledge, too much knowledge about it either. I didn't have any knowledge about the laws until all of this happened. And then that just made me want to, like LaShonda said, wants to go on and keep on fighting this fight. I know that now, with learning the laws, or a little bit about the laws, I'm able to tell my clients who test positive that come in about the law, so they can be aware. Unfortunately, we weren't aware at the time, but being an advocate now, I'm able to spread that information so that they can know what to look for and what not to do, and to try to avoid from being on the registry.
I have to say, I'm like you. I don't say I accidentally got thrown into it. It was actually me that spoke to a lady, and pretty much I wanted to tell my story, and that got me into advocacy. And like you, I want the people to know, this is the law. Watch out for it. Keep
Mhm.
yourself protected at all times, regardless of what you do. You might think it's safe to do this, or because you're in a relationship with a person and y'all have been in a long relationship, so now you want to have unprotected sex. I recommend no, unless you get a video of them or of you two stating, I know that I'm HIV positive, and do you understand that? And that will keep you from being charged with this crime.
And I make sure that I do try to inform my clients, because most of my clients now are under the age of 25. So they're young, they think that they are invincible and they can do anything with no kind of repercussions behind it. But at the same time, I do try to make sure that I help them understand what the law is and practice ways of disclosure, to whether they can avoid from being told, or someone reporting them saying that they gave me HIV and I didn't know, or just making sure that I lay out all those steps for the clients. Um, Trying to do something that wasn't really laid out for me. So that's why I see myself pushing so hard for this change, because there are many Black women and trans women like me and LaShonda who aren't even aware of it. We just know that we tested positive for a virus, and nothing else is talked about that. It's more of just make sure you take your medications, make sure you keep your doctor's appointments. But this part is important to them as well because things happen, and we want to make sure that they are knowledgeable about everything that's going on, especially with the laws.
And another thing I wanted to mention too, and not to get off subject, but two, as you're on the sex offender registry, you do have to watch what city and states that you go into. If you're in that city or that state for more than 14 days, you do have to register in that county that you are in. So if you stay 15 days somewhere, you have to go register in that county. You have to let them know that you are a sex offender and you are from such and such county and you have been here over the 14 days.
All right. Thank you so much, LaShonda and Michelle, for sharing your stories with us today and for really educating the folks who are attending just about the really harsh reality of these HIV criminalization laws. So if you please show some love to LaShonda and Michelle in the chat, send them some hearts, because we know that this is really, difficult to share your story and really discuss these kind of really personal, intimate things. So thank you so much, LaShonda and Michelle. Now we're gonna move to the Q&A portion of today's presentation. We're not gonna have a lot of time. I apologize. We're not gonna be able to get to all these questions, but we're gonna try to get to a couple. So one of the questions I see in the chat is from Dwayne Houston. As someone who is HIV positive wanting to move to Memphis area, what advice would you have or resources would you recommend for our Memphis panelists?
I would say I could give you my contact information. So I work at a nonprofit for HIV health and care. And if you wanted to come to Memphis, I could put my information in the chat. Just give me a call, and we can set up on ways to get you linked to care and just finding the resources that are available in Memphis that'll suit you, that'll help with your transition to Memphis.
Thank you so much, Michelle. Another question I see in the chat is probably going, oh, Nathan already answered that, never mind. One of the questions is one that was already kind of mentioned from Angela about the analysis around the recent elections and how the new, I guess, DA will affect the criminalization of HIV in Shelby County for our Memphis panelists.
I don't know if it's going to affect the police because it's the vice squad that's going out and doing these undercover stings. What they need to do is provide services for people. And if someone's on the street and they have some problems, or if they need help, why do you bring them, arrest them and bring them in? Why not have more of an outreach and community linkage to help people? That's what I would say.
Yeah. And now I do see like there being hope with the district attorney elect. They are a person who I've kind of followed some of the things that they really stood for before the election and during the election. And that's why I was saying that is a ray of hope for the work that we do specifically in Shelby County. However, we can't really, dictate anything until the rubber meets the road. And that's just the honest thing approach or response to that. With that being said, though, hopefully, I think how we can really impact change in Shelby County, regardless if that person is in place or not, is really go ahead and start trying to maybe have meetings with the DA and talking to them about what protocols that these sting operations take and approaching folks and trying to change some of those things that are a little bit more, they're a little bit more not policy, but just how they do stuff, which we have to get in and start having those conversations. So hopefully we can start having those meetings in this next year and really be able to maybe impact how these sting operations happen and who they happen to. Because even, you know, if talking about like just being in a vulnerable place and loitering, like a lot of us loiter in Memphis, like this kind of like just a pastime. I mention it all the time. And I see a lot of police presence when I want to go and have an Arizona outside of the store. So I can only imagine if someone's out there and in a more vulnerable state, like, and they actually encounter the police, of what results could possibly happen.
Well, and I would like to add, I think that more of the lawmakers should get educated on HIV and how the science of HIV has evolved since the 90s, and it's not a death sentence. So we want to try to, I wish that they would get rid of that stigma, but I do wish that the lawmakers would get a little bit more education about this virus instead of just voting yes. Try to find out a little bit more about it. You know, I know it's a party issue kind of thing sometimes, but if someone in that party would really just take that time out to do their research and ask questions or meet with people who are living positive on the registry to learn a little bit more about it. I think a lot of that would really make a lot of these changes better. I would say that.
Thanks so much, everyone, for sharing. Barb, can you pull up my slides again? Thank you. This is just a quick poll. Who's ready to get involved with the coalition and help us to end HIV criminalization? Hopefully a lot of yeses in the chat. I know I'm a yes for sure. And I guess I'll kind of end with one of our questions that I saw in the chat was how do we work to change HIV, to end HIV criminalization within our own communities? And I think really getting engaged with the folks who are already doing this work, who have that expertise, who have that lived experience, and taking kind of your cues from them, I think is a really great way to engage in this effort. We have some resources on our next slide. If you want to join the Tennessee HIV Modernization Coalition, again, the meetings are every second Wednesday of the month from 11 a.m. to 12 p.m. Central Time. They're open to everyone, including people living with HIV and allies as well. They are also open to everyone in Tennessee, so they're a statewide coalition, and we basically just kind of hop on the calls and we kind of discuss any updates just around HIV criminalization or HIV related issues. We prepare like educational presentations. If we're going to like educate folks like lawmakers or something like that, we'll prepare for those there. We'll just kind of be, in community with one another, virtually, of course. Yeah, so I highly encourage you, if you are interested in joining the coalition, please head to the coalition's website and join the calls. And I'm sure if you want to speak more in depth about it, I'm sure you could contact our co-chairs here, Robin and Dwayne, as well. And I'm sure they'd be happy to discuss anything with you. Next slide, Barb. And again, couldn't end this without mentioning Health Not Prisons Collective. If you'd like to sign up for updates from H&P, you can do so at the link right there. I write a newsletter every quarter for H&P that discusses HIV criminalization and sex work decriminalization from a national and state-based perspective. So if you want to sign up for those updates, feel free. We also have another webinar H&P does tomorrow about the Repeal HIV Discrimination Act, which is a federal piece of legislation that's hoping to kind of end HIV criminalization and put in some measures and steps to start achieving that from a federal perspective. So if you'd like to come to that, the registration link is there as well. It's supposed to be it's going to be really great conversation. LaShonda will be on that panel discussion as well. So if you want to get more of LaShonda and hear more of what she has to say, please register for tomorrow's webinar as well. Next slide, Barb. And we couldn't let you all go without a little evaluation. We really want to know what you all think about today's presentation, about our panelists, about my moderation skills. So if you could please take the evaluation, it really just mean a lot to us, so we could just learn more about your thoughts and opinions about today's webinar. The QR link, the QR code is right there. You can scan it with your phone, or you can visit the link that I believe Kelly is probably going to drop in the chat. Next slide, Barb. Thank you so much, everyone, to our panelists who have really just engaged with this content so well and shared their perspectives and shared their knowledge and great stories. Thank you so much for being vulnerable with us this evening and sharing your stories. To our amazing audience, thank you so much for the questions. I know we weren't able to get to all of them, but thank you so much for engaging with us this evening. And if you'd like to learn more about Health Not Prisons Collective, about the coalition, about HIV criminalization in Tennessee in general, feel free to reach out to me. My contact information is listed there. Thank you so much, everyone, and have a great night.